Hello everyone, welcome to the video series on Target GPAT 22. In this video series, I am going to explain all the GPAT previous questions with explanations, and these videos will cover all the basics and concepts. In this video, I am going to explain about Pharmacology question series, and this is part 1. And this is my YouTube channel. If you like the video content, do subscribe and share the videos. Let's begin the topic. Now, the first question, as I told you, all these questions are from previous GPAT. So, please follow them. See, inhibition induction of which of the following cytochrome P450 enzyme is mostly involved in important drug-drug interaction? Now, the answer for this is cytochrome P3A4 family. Now, this particular enzyme is responsible for more than 50% of the drug metabolism. So, this particular enzyme is present in liver as well as intestine. In fact, some of the food-drug interactions are because of this particular enzyme family. So, remember, this is the most important cytochrome P450 enzyme class that is responsible for drug-drug interactions. Now, these enzymes can be inhibition by some of the drugs. Now, drugs which are popular inhibitors are clarithromycin. Clarithromycin is an antibiotic. Similarly, erythromycin, clarithromycin, both of them are antibiotics which are responsible for inhibition of this family. Along with this, you have azole antibiotics. Azole antifungals. Now, azole antifungals will also inhibit this particular family of enzyme. Now, we need to understand what happens by inhibition of this enzyme. If this enzyme is inhibited, the duration of action or T-half of the drugs will be elongated. So, drug accumulation may become a problem. Now, similarly, the drugs can also be induced. Induced means the enzyme activity will be increased with certain drugs, and drugs in that class are phenobarbital. Now, phenobarbital kind of drugs, when they are taken, they enhance the enzyme activity. So, what happens? T-half of the drugs will go down. Not only phenobarbital, drugs like phenytoin, rifampicin are examples for inducers. So, the basic thing is, the important one is cytochrome P3A4 class is responsible for more than 50% of the drugs. The isozymes are present in liver as well as intestine. They can be inhibited by drugs like clarithromycin, erythromycin, azole antifungals, and induced by phenobarbital and phenytoin. So, the answer is cytochrome P3A4 family. Moving to the next one. Now, which of the following mechanism is not related to platelet aggregation inhibitory action? Now, platelets can be inhibited by various mechanisms of action. Now, ADP receptor antagonism. Now, ADP receptors are known as P2Y12 receptors. Now, these receptors are present on ADP. When you block or antagonize that receptors, platelet aggregation is inhibited. So, this is related. The question is about not related. So, this is not the answer. Example for this class of the drugs are ticlopidine, clopidogrel kind of drugs like prasugrel. All of them, they act by inhibiting this receptors. If it is inhibited, platelets are aggregated. But the question is about not related to platelet aggregation. So, this is not the answer. Moving on to the next one, glycoprotein 2B3A receptor antagonism. These are also very powerful drugs like abciximab. These drugs will also cause platelet aggregation inhibition. So, this is not the answer. The next one, phosphodiesterase enzyme inhibitor, PDE, phosphodiesterase. Examples are dipyridamole. This is also an example for platelet aggregation inhibitor. This one also inhibits platelet aggregation. But what is the odd man out? This one, prostacyclin inhibitor. See, prostacyclins will as such inhibit platelet aggregation. So, they inhibit platelet activation. Why? They increase the levels of the PGI2. One of the potent promising example for prostacyclin is PGI2. This one as such prevents the formation of platelet plug. But if you inhibit that, what happens? Platelet aggregation will not be inhibited. So, that is what the question is about. Not related to platelet aggregation inhibitory action means this is the answer. So, example are epoprostenol. Epoprostenol is a potent prostacyclin. This one as such is used as platelet aggregation inhibitor. But when you inhibit that prostacyclin, what happens? So, the effect will not be there. It is not related to platelet aggregation. So, the answer is prostacyclin inhibition. Moving to the next one. Which of the following is inhibited by dipeptidyl peptidase 4 enzyme? Now see, this dipeptidyl peptidase 4 enzyme is responsible for metabolism of incretins. Incretins are present in our intestine. They are known as insulin secretagogues. So the job of incretin is they increase the levels of insulins and they are metabolized by dipeptidyl peptidase 4. So what happens when you inhibit this enzyme? The incretin metabolism will be inhibited and incretin levels are increased. So that will increase the levels of insulin. So this class can be used to treat diabetes. So the target of this dipeptidyl peptidase 4 enzyme is incretins. Now look at them: oxytocin, vasopressin, insulin, glucagon. All of them are peptide hormones. We have two different kinds of hormones are there, peptide and steroidal hormones. These are peptidal hormones. Now here this dipeptidyl peptidase 4 enzyme metabolizes incretins and that inhibitors are used to treat diabetes. Moving to the next one. Now most of the emergency contraceptives have one of the following active ingredient. Now understand this question, this is emergency contraceptives. And emergency contraceptive, the major ingredient is levonorgestrel. In fact, this is a progestin analog. Now usually the job of this drug is either it will disrupt ovulation. So ovulation will be disrupted, or it may disrupt fertilization. So both the actions are required for emergency contraception. Usually it is given in higher doses like 1.5 mg, which are divided into two doses. Like 750 mg is given and then 750 is given. 750 mg, 750, it is divided into two doses. Now high dose of levonorgestrel is given and that is what causes disruption of ovulation or fertilization. Now estradiol is an estrogen analog which is used to treat menopause syndromes like hot flashes, edginess. All of them can be cured by estradiol. Norethindrone is a type of progesterone. It is also used to treat menstrual disorders. Now misoprostol is a prostaglandin analog which is also used to cause abortion or to start labor. So everyone has got a unique significance, but the emergency contraceptive is levonorgestrel. Moving to the next one. Antiretroviral Raltegravir mechanism of action. See, integrase inhibitor is Raltegravir. Now what is this integrase is, when virus gets into the human body, it makes up its own DNA. And this DNA is integrated in human DNA. And this is possible with the help of this enzyme integrase, and this enzyme action is inhibited by Raltegravir. Now co-receptors are there, they are known as CCR5 receptors. Example for this is Maraviroc. Maraviroc is the drug which will blocks co-receptors which are present on the cells. Now this is fusion inhibitor. Now fusion inhibitors are the drugs known as enfuvirtide. So the viral cell will be fused with CD4 cell and that fusion is inhibited by drugs like enfuvirtide. Now reverse transcriptase, you have nucleoside reverse transcriptase inhibitors are there, non-nucleoside reverse transcriptase inhibitors are there, like zidovudine, lamivudine, nevirapine, all of them will come here. Now the question here, Raltegravir, the mechanism of action is integrase inhibitor. Moving to the next one. Which of the following is not an example of G protein coupled receptors? See, 70% of our receptors, the drugs which will target receptors on G protein coupled receptors, a very prominent group. Now muscarinic cholinergic receptor, yes, it is a G protein coupled receptors. Alpha adrenergic, beta adrenergic, yes, both of them are G protein coupled receptors. What is the odd man out? Nicotinic cholinergic receptor is an ion channel receptor. This is not a G protein coupled receptor, rather it is ion channel receptor, a simple one. Now, which of the following antibiotic produces concentration dependent bactericidal action and also poses post-antibiotic effect? Now understand this one. When you look about antibiotics, there are two different kinds of mechanism of action is there. Time dependent kill and then concentration dependent kill. What do you mean by this thing? Time dependent kill means time to time the antibiotic should be taken, like cephalosporins, penicillins. How do we take? Per day 2 tablets for 3 days or 5 days course is given. That is time dependent kill. When you give the drug time to time, that will kill bacteria. Some other classes of drugs are they will exert concentration dependent kill, like aminoglycosides. Aminoglycosides, when you increase the concentration, the killing ability of bacteria will be increased. Not only aminoglycosides, fluoroquinolone too. Both of them will show this property called concentration dependent kill. Now, what is this about post-antibiotic effect? Post-antibiotic effect means even after the antibiotic concentration is fallen down than the required concentration, some of the antibiotics will show their effect. That is what is called as post-antibiotic effect. Again, aminoglycosides will show this effect. So the question is about, you need to pick a drug which has got concentration dependent kill and post antibiotic effect, and for both of them aminoglycoside is an example, and here it is amikacin. Amikacin is the choice of drug. Understand this concept. These are important chemotherapeutic concept: time dependent kill, concentration dependent kill, and post antibiotic effect. So the answer is amikacin. Moving to the next one. What is chemotaxis? Now, chemo means chemical, taxis means movement. So, movement of leukocytes in inflammation or movement of certain agent according to chemicals is called as chemotaxis. So, the answer is this one. Moving to the next one. Rhabdomyolysis is the side effect with which of the following classes of drugs? Now, understand this. Myo means muscle. Lysis means breakdown. Rhabdo means striated muscles. So, in this particular condition, striated muscle breakdown occurs, and this is caused by which kind of drugs? Statins. Now, statins like simvastatin, pravastatin, lovastatin, all of them will show this kind of side effect. Now, one of the reasons why they show this effect is the job of statins is to lower LDL as well as cholesterol levels in human body. So, lipids are going down in human body. When lipids are going down, body requires energy. The energy's requirement is met by either carbohydrates or by lipids. And lipids will provide highest amount of energy. By continuous use of these drugs will reduce lipid levels. So what happens when body requires energy, it surpasses these two and goes for proteins. What happens with this? Protein breakdown occurs. This protein breakdown is nothing but myolysis, especially striated muscle will break down occurs. This is what is the purported reason. So remaining drugs has got different kinds of effects. ACE inhibitors, calcium channel inhibitors, both of them will cause hypotension. And ACE inhibitors will also show dry cough and all these things. But rhabdomyolysis is the major thing with statins. Moving to the next one. Now, nitroglycerin, if taken along with sildenafil, which of the following effect is observed? Now, what is the job of nitroglycerin? It causes vasodilation. Now, how does it cause? Nitroglycerin releases nitric oxide, which causes vasodilation. Now, sildenafil, PDE3 inhibitors, phosphodiesterase inhibitors. So, what happens with this? With this also vasodilation occurs. So, both the drugs will cause vasodilation, a prominent vasodilation occurs, and that is what results in severe hypotension. When blood vessel is dilated, what happens to the pressure inside? It falls down. That is what is known as severe hypotension. Moving to the next one. Now, which of the following is true for angiotensin II? Now, see, angio means blood vessel. Tensin means increasing tension or causing contraction. When blood vessel is contracted, what happens? It rises blood pressure severely. Now, we need to understand the effects of angiotensin II. There are a lot of effects of angiotensin II. Angiotensin II are there. What is true? It causes myocyte hypertrophy. True. Hypertrophy, increase in size of the cell occurs, especially cardiac myocyte hypertrophy occurs. Why it happens is, look at this. If this is heart, because blood vessels are contracted, more amount of venous return will be there inside the heart. More blood reaches in the heart. When more blood reaches, what happens? It puts pressure on the walls of heart. To sustain this pressure, hypertrophy of this heart occurs. So this is what is called as cardiac myocyte hypertrophy. So this is true with angiotensin II. What are the remaining things? Decreases sympathetic nervous system. No, in fact, it increases sympathetic nervous system activity. Angiotensin II. Second one, decreases force of myocardial contraction. No, it increases force of myocardial contraction, which is also known as inotropic effect. Heart rate is increased. Next, decreases synthesis and release of aldosterone. No, it increases synthesis and release of aldosterone. All these two are not true. Only true one is it causes myocyte hypertrophy. But remember, all these things are actions of angiotensin II. Moving to the next one. Which of the following vasodilator action is not mediated through nitric oxide? Bradykinin. When you see the mechanism of action, it releases nitric oxide. Acetylcholine indirectly releases nitric oxide. Hydralazine releases nitric oxide. All the three are related to nitric oxide. What is not? Minoxidil. Now, how this minoxidil acts? Minoxidil is a potassium channel opener. When potassium channel is opened, it causes vasodilation. So, what is the question about? The question is, which of the following vasodilator action is not mediated through nitric oxide? Means it is minoxidil. So, the option B is answer. Moving to the next one. Now, look at this. Blood level monitoring of HbA1c is associated with which of the following disease? Now, see, this is a very popular one. One of the diagnostic tests to find out diabetes is to find out blood glucose level. But HbA1c is a perfect measure to see how much amount of glucose is present in the blood for the past couple of months. In fact, it is known as, see what happens is, in the blood you have a lot of amount of glucose is there in diabetes. This glucose will bind with hemoglobin, that is called as glycated hemoglobin. Glycated hemoglobin, that is what is known as HbA1c. So in this test they will find out how much amount of glucose is bound to hemoglobin. The normal levels are 4 to 6%. If someone has got 4 to 6% of glycated hemoglobin, that is normal. The 6% of glycated hemoglobin means there is around 126 milligrams per deciliter of glucose in the blood. If it is more than this, that indicates there is a condition of diabetes. For example, if 7% of blood has got glycated hemoglobin, that corresponds to 154 milligram per deciliter of glucose. See, and the best thing is, this will give you an average glucose levels for the past 2-3 months. So, monitoring of HbA1c is associated with diabetes mellitus. Moving to the next one. Now, which of the following beta blocker shown to reduce mortality in patients of symptomatic heart failure? Look at the options. Atenolol, esmolol, both of them are beta selective blockers. Beta 1 selective blockers, both of them. Now, propranolol, non-selective beta blocker. Now, carvedilol, alpha and beta blocker. Now, which is shown to reduce mortality in patients, in heart failure patients, is carvedilol. The reason for carvedilol is it has got a particular antioxidant property is there, and this antioxidant property is beneficial in endothelial dysfunction. Endothelial or pavement cells of the blood vessel and apoptosis. So both of them, endothelial dysfunction is reduced and apoptosis is reduced due to this antioxidant property of carvedilol, and this is advantage in heart failure. So the option is carvedilol. See, all of them are beta blockers, no doubt, but carvedilol has got this advantage. Moving to the next one. Which of the following does not induce mydriasis? Mydriasis means pupil dilation. Pupil dilation. Usually adrenergic drugs will cause pupil dilation, cholinergic drugs will cause pupil constriction, but anticholinergics will cause pupil dilation. So atropine causes pupil dilation. Ephedrine, cocaine, all of them are adrenergic drugs which will cause pupil dilation. What is odd man out here? Phentolamine. Phentolamine is an adrenergic antagonist. Phentolamine is not an agonist, it is an antagonist. So this one will not cause mydriasis. So the option C is correct. Now, which of the following is a non-competitive inhibitor of enzyme reverse transcriptase? See, nucleoside reverse transcriptase inhibitors will inhibit competitively the reverse transcriptase enzyme, whereas non-nucleotide reverse transcriptase inhibitors will not inhibit competitively. And the example is nevirapine. Lamivudine, abacavir, tenofovir, all of them are structural analogs of nucleotides. So they go imitate the structure, competitively inhibit reverse transcriptase enzyme. Nevirapine is not like that. So the option is nevirapine. Now, which of the following is most effective monotherapy for raising HDL cholesterol? Now understand this one. Statins, how do they function? They lower LDL. Ezetimibe, it lowers cholesterol absorption. Understand this one, it lowers cholesterol absorption. Omega-3 fatty acids also lowers LDL, but the most effective monotherapy for rising HDL cholesterol is niacin. See, omega-3 fatty acids also increase HDL, but the most effective one is niacin. It almost 20% HDL levels are increased by niacin. So this is important one. Moving to the next one. Which of the following is a molecular target for Vinca alkaloid? Vinca alkaloid is an anti-neoplastic drugs and it targets tubulin. There are so many drugs like alkylating agents, all of them will target DNA, but Vinca alkaloids will be targeting tubulin and inhibit cell multiplication. Going to the next one. A patient with a history of type 2 diabetes is diagnosed with heart failure. So there are two existing conditions are there, diabetes mellitus plus heart failure. Now, which of the following is a poor choice to control diabetes? Now, understand this. So, you need to find out a drug out of these four which will adversely affect heart function. So, the option is pioglitazone. The reason is pioglitazone will causes water retention. What happens when water is retained? When water retention is there, it causes edema, and edema worsens heart failure. So, pioglitazone should not be used. Metformin, pioglitazone, both of them are insulin sensitizers, glipizase, insulin secretagogue, and exenatide is a incretin analog. But remaining three can be used safely, but pioglitazone you should not use with a condition of heart failure and diabetes mellitus because it causes edema. Moving to the next one. Choose the correct pair of neurodegenerative diseases. Now, neurodegenerative diseases are progressive. Progressive means as people age, the disease condition worsens. The other feature is it has irreversible loss of neurons are seen in this neurodegenerative diseases. The example for that is Parkinson's and Alzheimer's disease. Parkinson's, dopamine neurotransmitter loss is there. Alzheimer's, acetylcholine neurotransmitter loss is there. Parkinson's will cause movement disorders. Alzheimer's will cause amnesia, memory loss is there. So the option is Parkinson's and Alzheimer's disease. So these 20 questions are asked in GPAT previous papers. Go through it. If you like this video, share the video, and thank you for watching this video.